Hi, I'm Dr. Sally Foote. Nice to have you back here on my Facebook Live. So today I'm going to talk about a new pain relief medication that has literally just coming out for release to all the most of the veterinary practices, not all of them, but most of them, called Solensia. Solensia is an injectable, sorry, it's my stuffed cat. Solensia, is an injectable pain-reducing medication. It is a product that will decrease the nerves growing into an area where there's inflammation. That's really about the simplest way to explain how this product works. The company Zoetis that has released the product has released it in limited supply to certain practices for getting it out for clinical use. And over the next few months is increasing availability for veterinary practices to have this available as a choice, as a product to help these cats, a lot of our older cats who have arthritis. Many studies have shown, that the majority of cats over the age of 9, about 90% of them have arthritis either in the lower lumbar spine or in the elbow. And of course, cats are not going to cry in pain. They're not going to show overt or obvious pain. And one of the biggest challenges we have is, first of all, how to help our clients know how to bring cats into the veterinary clinic for care. I've covered that in other Facebook Lives and things, but that's one aspect of it. So there's going to be a lot of push for helping cat owners to understand or learn, how to make travel nice, etc. Now, the real issue is going to be when that cat comes in for an examination. Maybe this is a cat we have not even examined for like the past 15 years or 10 years. So how we can help that cat have a less stressful examination, especially considering these points on the body that may be in pain. This may be the first examination whereby we may decide, yeah, let's go ahead and give them an injection of this Solensia and see how it helps them. So I'm going to go ahead and cover some of the handling aspects that I would like all of the veterinary staff, shelter staff, non-veterinarians, cat behaviorists, people who help people with cats, and cat owners can practice it as this at home, and some of these steps at home to help prepare their cat to be more calm and less stressed at the veterinary clinic. This is absolutely important. It's important not only for the memory of your cat, but actually it is in the drug handout how some of these cats, if they're tense, will have more pain on receiving the injection. So we have to have these cats' bodies be a little more calm, a little more relaxed. And if I have not examined this cat in the current year, I cannot prescribe pre-medications to help that cat to be more sedate or calm for coming in for exam. So it's really a lot about the handling right when they come into that clinic. That's a big important part. Okay, so some of the things I want to make sure all of us know as protocol. It should be for all cats, but especially our older kitties. As I call it, cranky older kitties. I love them, but because they're painful, they're a little cranky, right? A little irritable. Every veterinary exam room needs to have a towel on the table, period. No exceptions. Okay, folks? Always have a towel on the table. Make sure you have put the Feel Away spray on this towel ahead of the exam so the cat feels like they have been here. Now, if the kitty is one of these kitties, get some of my props out of here. Say this was a kitty who was tending to hide in the back of the carrier. You're going to take the top of the carrier off. I'm going to do in-carrier exams. Or we have a spare carrier where we do my slow dump truck technique to have the kitty in the carrier. Now, in that case, the towel that was on the table, you're going to take off, and we're going to cover the cat like so in the carrier. Because a cat who's hiding in the carrier does not want to be seen. They don't want to be out of the carrier. They feel very vulnerable. In which case, then, the way we're going to handle the cat, let me stand up here, is that we're going to have the towel then serves by taking the front edge of the towel, make sure it's tucked under the front of the carrier. It serves as a method of restraint. Also, you want to avoid any holding down or tight holds. There's no need with the carrier here. This carrier is like containing the cat. Secondly, whenever there is a source of inflammation in the body, but especially when the inflammation is coming from the bone, it increases the sensitivity to touch. And remember, a lot of these cats will not have gabapentin on board or any other medication to decrease sensitivity because we may not have seen them. in the last year. I cannot prescribe that drug. So think of this towel as being an insulator. It's insulating or kind of giving that padding between the hand and the skin to decrease how intensely touch feels to them. And so this insulates it. Plus you also do not need, because the towel in itself draped over the cat helps the cat to feel hidden. They're less likely to want to struggle or jump out. You do not need to hold them tightly. Okay, so a light touch, usually all I want the assistant to do is put their hand here or maybe no hand on them. Now we can flip the towel back and I can palpate the abdomen. I can listen to the heart and lungs. When we rotate the cat, especially on our older kitties here, you're gonna put two hands, I'll tip it this way so everybody can see a little bit better. Two hands on either side of the shoulder. Do not grab over the scruff, okay? That's a big no-no. Two hands on either side of the shoulder, and honestly, it's best if you have two people, so it could be veterinarian or head tech, come along the side, so they have two hands on the side of the hip. And on a count of three, you guys have to be coordinated this, 1, 2, 3. You're just gonna rotate the body. Do not lift and do this, okay? That's a lot more manipulation, and the cat's back tends to twist. Okay, what's happening underneath that towel is if you go up and over like this, you see how that, you can have like a little bit of twisting. This is why I have a stuffed cat here, folks. You can have a little twisting over the spine exactly where they hurt. Then they're going to suddenly shriek and bite. That's pain-triggered aggression. So these are really important considerations, especially when handling our older cats that are painful or an injured cat. Okay, so let's say the kitty is a little more confident. He's up toward the front of the carrier. He's willing to come out. Hey, it's great. But we still have to remember he may have some pain, right? So we have our towel down on the table. Kitty comes out. Now, sorry, I forgot my clip. I'll be right back. Okay. So, as a method of holding the cat, I recommend we take the towel. This is called, I call this the shroud technique because it's like shrouding their body. We're not tightly wrapping. A lot of these old cats, they may not like that firm wrapping with the towel because it's actually putting a lot of stimulation, on the body. But we need, because they may swat, and again, we want that insulator effect, right, of the towel across their hand. And we want, many of you, I understand, have always been trained and always used scruffing or grabbing the base of the neck as a method of holding. But we want to, sorry, all these messages come in on Facebook. Anyway, we want to eliminate that, yet still have that anchor point. So the shroud technique works. Here's a quick way to do it. Take the edge of the towel up and underneath around the head, and you have, your handy little chip clip, which only goes on the towel. You do not clip the cat's skin, okay? So I'm gonna clip the towel, so now my hands are free, and we can, as you can see, just drape this over the cat's body. Again, you have that insulator effect. And if my assistant needs to hold, and maybe between them just positioning or their own sense of security, they want to hold that point that's like scruffing, but it's not scruffing, right? They can hold like so. You see how it's the same anchor point, but there's no pinching on the skin. In scruffing, it's a really important point, just sent out my newsletter about this. When we pinch the skin with scruffing, what are we doing? We are pinching the skin that is going to send a stimulation down the muscle, down the skin, down the nerve endings, right to where that arthritis is here or here. That is why these cats may hunker down and they may freeze. They're holding still, so it looks really convenient, really easy to treat them. Yes, I get that. But what they then associate is hands create pain, and the next time, the Solensia has to be given once a month. It's a once a month injection that cannot be given for home administration. It's some things about the drug and the agent that we cannot take a risk of accidental self-injection, especially with the client. Yes, staff, we're going to need to be very aware of this. That's another Facebook presentation. But anyway, the cat's going to have to keep coming in every month. So if, by default, the staff just takes a second to do this, that cat's going to build up stress and resistance and start to struggle for getting this injection, which will then increase the pain of receiving the injection. So let's use these techniques, the shroud technique, use the